Okay, so we're back to talk about the normal discomforts of pregnancy. There's a lot that nurses can do to help moms self manage these. And we sometimes have to debunk some myths about them or interrupt some uh, maybe harmful health practices. So, we're going to talk about nausea and vomiting first, and then I'm going to backtrack to the last slide. Nausea and vomiting are very, very common in early pregnancy. And there are some things that we can do about it. It's caused by increased levels of HCG and estrogen. They sort of activate those nausea and vomiting centers of the brain. And there's also delayed gastric emptying because of progesterone. So we're going to teach mom, avoid an empty stomach. That makes everything worse. Frequent small meals and large snacks. Dry crackers or toast before she gets up in the morning. Have a big packet or box of saltines right next to the bed. Avoid greasy, spicy foods and strong odors. Some women use aromatherapy. There's something called Queasies. It's a little inhaler. You can get it over the counter or through Amazon. And it has like peppermint oil and lavender and a couple of other things that may help. The old trick that nurses will use sometimes is to take an alcohol swab and put it under mom's nose and tell her to take a deep breath. It seems to confuse vomiting centers of the brain. In extreme cases, we may have to give an antiemetic, but mostly the dry crackers and avoiding anything that might trigger nausea and vomiting is important. And now I want to go to here, slide 29. We're going to go backtrack to fatigue. This is common in first trimester. It's also common in the third trimester. Mom needs to know it's okay to nap. This is like an ungodly tired, by the way. It's not just your normal everyday walking around feeling a little bit low. This is a really sleepy feeling. So encourage mom to get a full night's sleep. Early in pregnancy, mom is still carrying out her normal routine often, and she's one of those workaholic type folks. If she can get a full night's sleep without interruption, it's really important for her to do so. She can nap or rest during the day. It's harder when you have toddlers, but if she can nap, she should. Encourage good nutrition and prenatal vitamins to make sure she's got enough hemoglobin in her blood. If she gets anemic, that fatigue is going to be a lot worse. Breast tenderness is also common in early pregnancy. It's one of the first symptoms. Teach mom to wear a supportive bra that fits well. That will help, and it will go away. I already talked about nausea and vomiting. One last thing about nausea and vomiting, though, be aware that in some areas, women may use marijuana to self-medicate. That is a practice that, needless to say, should be discouraged. But that has been anecdotally reported. I've seen a lot of women come in and say, I used it for morning sickness. So we want to encourage her to use healthier strategies. Other discomforts in the first trimester, urinary frequency. This comes back in the third trimester. It is because you now have a gravid uterus pressing on your bladder. Mom should know that having to go often is normal, but pain or burning is not, and is a sign of a UTI. Mom should be drinking a lot of fluid during the day and peeing often during the day, but about 2 to 3 hours before she goes to bed, she can really cut back on that fluid intake. Otherwise, she's going to be up all night going to the bathroom. Kegel exercises. Kegel exercises exercise that PC muscle. It's when you stop and start the flow of urine to sort of strengthen that muscle that will help her from involuntary release of urine or stress incontinence when she sneezes, coughs, laughs, whatever. Another common symptom in the first trimester, nasal stuffiness and nosebleeds. It's because of all the estrogen making the mucous membrane swell. So extra fluids, the more she drinks, the less thick that mucus is going to be. Some saline nasal sprays, but not like neosynephrine or anything with a more pharmaceutical component. Humidifiers might help. And if she has a nosebleed, teach her to tilt her head forward, pinch her nose with a tissue, and apply ice to the bridge of her nose. And these are kind of normal things. They are not comfortable, not pleasant, but they happen. Constipation is another one because of the increased progesterone and the effect it has on the bowel. So we're going to teach mom, increase her fiber, her fruits, her vegetables, her whole grains. All those things have good nutrients for the baby too. But fiber really works best with lots of fluid. She's really uncomfortable. Prunes, prune juice, warm liquids like decaffeinated tea or coffee can promote peristalsis. She should be exercising daily. You can reduce cheese or white bread, anything that constipates her. And then if we need to go a little bit further, Colace is considered safe during pregnancy, but she should avoid strong laxatives and never take anything without her providers say so. Now we get to the second trimester, and this is where most women feel pretty good. The fatigue goes away, the breast tenderness goes away, the nausea usually goes away. The urinary frequency lets up a little bit. But, as the baby gets bigger, we do see some things start. They will continue throughout the third trimester, like heartburn. Heartburn is famous, and people will always reference that myth that heartburn makes the baby's hair grow. So if you have a lot of heartburn, your baby's going to be born with a full head of hair. Not true, by the way. But it is because of the impact of progesterone on the lower esophageal sphincter, and also the upward pressure of the baby. So you're going to teach mom, elevate your head at least 30 degrees when you're laying down. Avoid laying down for 3 hours after meals. Avoid spicy or greasy foods or anything else that triggers you, like coffee or chocolate. And only use the antacids approved by your provider, like Tums. Tums also provides calcium, so that can help with that. When we get to leg cramps, that will sort of play in. Supine hypotension starts after about 20 weeks when the baby grows big enough and the uterus grows big enough to compress the vena cava when you're laying flat. So mom will get this dizziness. She will feel all of a sudden very unwell if you have her lay flat. For example, if she's laying down for an ultrasound, we always try to elevate the head a little bit. If she experiences this, she should be in a sideline position. Mom should be sleeping on her side from that point forward, from about 20 weeks forward, because blood flow to the baby, if you're decreasing blood flow to mom's brain, you're also decreasing it to the baby. So we want her to lay on her side. Second and third trimesters, again, you might see leg cramps. And this is sort of a normal thing because calcium levels are in flux. So mom should know to prevent leg cramps. They're like a Charlie horse. Sometimes they wake you up in the middle of the night. She should elevate her legs when resting. If they happen, she should flex her foot towards her shin and stretch out the muscles. Sometimes like that runner's lunge will help. Anything that elongates that calf muscle will usually get the spasm to relax. And calcium supplements like Tums may help, but she should talk to her provider about that. Backache is common as that baby grows. We talked about lumbar lordosis. Teach mom to wear flats or low-heeled shoes. The more support, the better. High heels are really not great for pregnancy. They do increase the risk for falling, and they will increase backache. Pelvic tilt exercises where mom maybe stands against a wall and just tilts her pelvis forward to kind of curve that back out of that exaggerated lumbar curve, and those cat-cow yoga poses. If you don't know what they are, Google that. It's, mom gets on all fours and she sort of stretches out her back to look like a cat, and then she arches it to look like a cow. That can help a lot. Dependent edema, very common in the third trimester. So these are things that happen towards the end of pregnancy. You really shouldn't see edema all over the body. That's kind of a warning sign, but in the ankles and the feet, some women get the Flintstone ankles. Rest with your feet up. Get a little exercise during the day to help those valves in the veins become more competent. Drink plenty of fluid to keep yourself from retaining too much fluid. Ease up on the salt. But resting with the feet up is the big thing. Support hose may help, may not. Varicosities. It's very, very common to see varicose veins develop during pregnancy as a result of the pressure of the gravid uterus on all that venous return. One type of varicosity is in the leg. The other is hemorrhoids. They're in the rectum. So avoiding constipation would be important. Avoiding long periods of sitting or standing also will prevent varicosities of all kinds. Some moms actually get varicosities in the vulva, and you'll see that, as a labor nurse, you might see some of those varicose veins. Dyspnea, or that mild shortness of breath, again, in the absence of respiratory distress. Never assume, always assess. Mom says, I'm short of breath, take a listen, put a pulse ox on. But if she's really just, experiencing that normal shortness of breath that comes with pregnancy, teaching her to sit up straight will help make room. Periodically stand up, stretch your arms over your head, and take a deep breath while you're doing that. Mom should elevate the head of her bed when she's sleeping or resting. That expands the rib cage, just like you raise the head of the bed with anybody who says they're short of breath. Avoid any overheating. That's just going to make it harder. And obviously, if mom is smoking, she should quit. Resting after exercise. If mom gets sort of dyspnea on exertion, she runs up a flight of stairs and all of a sudden she has to catch her breath. Teach her to move a little slower and also to rest after. The dependent edema, we kind of already talked about. Changing position frequently, support hose, all of that. Urinary frequency returns in the third trimester, so it's the same tips you did in the first. Increase your fluid intake during the day, but decrease it 2 to 3 hours before you go to bed. Do your Kegels. Do not try to hold your bladder for too long. Sorry, it's my coffee pot. Increased vaginal discharge is also common in the third trimester, so mom should be taught to wear cotton underwear, have good perineal hygiene, always wipe from front to back, no strong soaps or douching. Braxton Hicks contractions. These are contractions that don't change the cervix. Now, sometimes it's hard for mom to tell the difference, and we talk about preterm labor in a separate video. But these are usually not as painful. They are irregular. Walking helps them go away. They feel like tightening. The stomach the abdominal area may feel hard when you palpate it, but then it goes away. Mom should be taught to drink plenty of fluids. That actually dilutes the level of oxytocin in the blood, make her contract a little bit less. She can use breathing exercises or distraction. They're really normal, and they're going to continue until she goes into real labor, which is topic for another day. And that is some information about discomforts of pregnancy.